Hello there. Welcome to a short and sweet selection of movements for your foot and ankle strength. We're calling it a KinChunk because we're going to try to get to as much work as we can in about 15 minutes. So to start, I'm going to have you actually start seated on the ground. You can lean back against something. And we're just going to do a little test movement that we will retest later, which is for your toe control. So actually begin by making your bottom of your foot flat. Lift all of your toes up, and then keep an eye on those toes staying up as you just lower your big toes down to the floor and back up. Now as you repeat this just for 30 seconds, you're trying to keep those little toes up, really actively pulling them up off the floor, but especially you're focusing on keeping the ball of your foot pressed into the ground, because as you lift that big toe, your foot's going to try to roll and lose contact with the ball of the foot on the floor. Go ahead, do one more, and then hold that big toe up in the air and do that same lowering now with the little toes. Yep. There you go. Trying your best to actually set them down as wide as you can. So you're actually finding some daylight between the toes if possible. Yeah, good. Just a few more seconds here. Really noticing how much motion you're getting, but also any sensations of contraction that you can feel in the top of your foot, top of your ankle, and your shin. And then go ahead and relax those down. Okay, so that's our movement we're going to come back to. Let's now warm up the rest of the bottom of your feet. So you're just going to kind of wedge your heels into the floor, think gas pedal up. So you're really actively dorsiflexing your ankle. And then from here, start curling your toes over, never losing that gas pedal up feeling, but really engaging almost like a fist squeeze sensation for the bottom of your feet. And then go ahead and start opening the toes up and doing your best to try to stretch open the bottom of your feet. You will not likely feel a stretch, but that's what you're aiming for. Keep going back and forth, curling those toes, not letting the ankles change shape at all, but really just focusing on the independent motion of your foot and all the joints in your foot. Good, very nice. So many of them. Now, especially as you get a feel for this, the big toes will be easier to feel again. So really think of curling the outside of the foot and that little toe in as well. You might get some extra crampies. Good. One more rep. Flirt with that cramp. We're ringing cramp bells here for you.
It's an invisible cramp bell, but I just rang it.
Yeah, I was thinking that might be an inside joke if you don't know the cramp bell thing, but we really love to reward and encourage that. All right, and relax that. Okay, so letting the feet go for a moment, we're going to now work on just the fundamental motion of the ankle. So let's go ahead and do this one side at a time. Keep your heel kind of notched on the floor. You can bend the knee a little bit, and you can see Hannah's using a hand to monitor the thigh. That's a great idea. Again, gas pedal up. And then that fundamental motion is going to come from tilting the bottom of your foot one way and then the other. This is called a capsule car for your ankle, and it's really engaging the contraction of the medial side, inside of your ankle, and then the lateral side. And this motion actually dictates and determines how much range of motion you have in all the other directions, including pointing your toe or gas pedal up, flexing your toe. So if this is a new movement for you, this is a great place to focus. Just a few more seconds, feeling as much as you can, contraction-wise, all the way up the lower leg, finding that complete stop, and then relaxing and letting that go.
Woo.
Nice. As we do the other side, a few ways to think of this drill. You can go ahead and get started with it. Hannah often talks about like a light on the bottom of your foot that you're trying to shine in each direction. That kind of like creative reformulating of the task can be essential to unlocking, what this movement really is for your body. Because especially if you're limited, it can be hard to feel the tissue that is supposed to do this job at first. So just keep trying to reformulate the ask, and you'll get a better and better handle on it as you go. 10 more seconds. As you progress as well, you can try to keep the toe motion still, although that'll be very, very difficult at first. So just, if you're ready for that extra challenge, see if you can keep the toes fixed with the rest of the foot as you do this tilt and relax. Nice. Okay, so now you're going to come up to standing, and it'll be useful to be near a wall. And you're also going to want to grab a couple props, tennis ball and a yoga block. All right, so we'll get to those in a second. So start actually with that tennis ball. You're going to plant that right between your heels. And then when you look down at your feet, you want to basically see parallel feet. So your big toes are pointing in the same direction. They're not angling out at all. And then you can throw a hand on the wall just to make sure balance isn't an issue for you. And start pressuring your toes and forefeet into the floor so that your heels start to come up. And you want to lift them as high as you can without losing that tennis ball squeeze. Lower down, tap your heels, and then right back up. Okay, so moving back and forth. And the idea here is partly to strengthen all the tissues in your calf, Achilles tendon area, and into the bottom of your feet. But right here at first, it's actually just to get a ton of blood flow going through those tissues, because the more blood that we have available, the more pliable that tissue is, and the more work we can get done for the stretching work in just a second. Good. Good, 15 more seconds. Continue finding that complete stop at the top. So you're really teaching your body how much lift you're able to find. Good. And on this last one, challenge yourself to lower smoothly with control. Okay, all the way back to the floor. And then you can lose that tennis ball. We'll come back to this one in just a moment. All right, now we're going to work on stretching the bottom of your feet. So I'm going to have Hannah use the right foot first. You can see the yoga block is right up against the wall. Swing over here. And what you're going to aim for is to get the pads of each toe onto the edge of that block. So to get the pinky toe, you generally have to kind of tilt your body so you're not facing head on to the block, but you're actually turned a little bit. Once the toe pads are on the block, then you're going to slide them down the block until the bottom of your foot is in contact with the floor. And then you're just hunting for that stretch sensation in the bottom of your foot, all of that plantar tissue. As you hang out here for a moment, you might want to micro-adjust by bending the knee, twisting or turning the knee in a different direction. All of those variables can change which tissue you're communicating with in the bottom of your foot. And you really want to just settle into that stretch. Take a few deep breaths here. See what you can ask to let go in the bottom of your foot. And maybe have an idea that you're trying to access muscles that are really deep in your foot. So think deeper into your arch, because there's basically layers upon layers of tissue, any one of which might be a limiting factor. So you want to just relax your way until you're feeling those deepest tissues. All right. For time's sake, we're going to get going into this contraction, but feel free to extend this passive stretch if it feels good, or if we've indicated that you should. So for this first contraction, you're going to start pushing the pads of your toes into the block very lightly at first, so that you really can clock that active effort in those stretching tissues. As that becomes more obvious, start to increase the pressure that you're pushing into the block with your toes. And then continue adding intensity by making the forefoot a little bit heavier into the floor. And keep building that task up until you feel like maybe your heel is going to try to come away from the floor. And we want to keep the heel on the floor. So really, how much pressure can you put into the block? Find that greatest safe effort. Hold it. Good. When we get to 0, I'm going to ask you to try to lift your toes off the block, but nothing in your body is going to move. 3, 2, 1. Switch to trying to lift those toes away from the block, engaging all of the tissue on the top of your foot, front of the ankle, even up into the shin. Really tuning into that and asking that tissue to work as hard as possible for 5, 4, 3, 2, keep your position, but slowly melt into that stretch again. Okay? For today, we're going to come away from the block, but you're welcome to come back for repeat visits for this Pales Rails. Let's go ahead and just get the other foot in. So you're going to find those toe pads on the edge of the block. drag them down until your foot is flat on the ground.
Ooh,
Okay.
different on this side.
Yeah, and pick up on those sensations of stretch, noticing which lines of stretch are clear on your foot. Now, sometimes when you find a new area to stretch, it might feel almost like a little bit scary or sketchy to your nervous system. So you might need to back off the stretch just a little bit. And to do that, you would just slide the bottom of your foot away from the block just a little bit. So you don't lose all of that toe flexion, but you just back it off a little bit. Again, if you're looking for more stretch, you would play with that knee bend or twist to really locate that stretch. And once you locate it, just deep breaths, trying to relax your nervous system into this position. Good. All right, so holding this end range position that you've found and relaxed into, start your pales contraction, pushing the pads of your toes into the block lightly at first. And then as that becomes clear and obvious, start to ask for more and more, building that intensity smoothly, starting to think of adding your forefoot pressure down into the floor. And then as you really ramp it up, almost imagining that you're trying to point your toes into the ground, but the block and the floor are in the way. So you're really fighting against those immovable objects all the way until you feel like maybe your heel would start trying to come off the ground, but you're going to keep it on the floor here for 5, 4, 3, 2. Now keep your position, but switch to trying to pull those toes away from the block for your rails contraction. Feeling that contraction in the top of your feet, front of your ankle, shin, even maybe up into the hip area and your torso. Really full body effort for 3, 2, 1, and slowly melt that away. Very nice. Okay, take your time to come away from the wall. And we're just going to kind of seal this in with one more set of those calf raises. It'll feel very different now. So go ahead and throw that tennis ball between your heels. Hand on the wall for stability. Really anchor all your toes and your forefeet into the floor. And then start 30 seconds of calf raises. Good. Again, tuning into where that stopping point is, where you can't go any higher before losing the tennis ball. And each rep, see if you can point those toes a little bit more, extend those ankles a little bit further, and really contract all of the tissues from the tip of your toes, through your heel, through the back of your ankle, up into your calf, and again, maybe even up the leg into the hip. Good. Final 5, 4, 3, 2, and 1. Relax. Okay, very nice. Now, another drill that we like to use for foot strengthening is going to involve a towel. So you're going to just place that towel, and you definitely want to use a larger size towel for this one, just so you have plenty of room. And then flatten it out on the ground. Place one foot, that's going to be your working foot, on the towel. And then the goal here is just to scrunch up the bottom of your feet to pull the towel in towards you. So you can see how Hannah is using the toes in particular and really focusing on that toe motion. But then the actual bottom of the foot rounds just a little bit as well to help. Sort of like what we were doing at the beginning with that initial drill. Now at some point, if you gather too much towel, you can just step your foot onto the flat part and keep going. Very nice. Really asking for control, but also strength and endurance from these tissues in the bottom of your feet. Very often, any issues you have in plantar tissue, like plantar fasciitis, is related to a degree of weakness in the active control of those tissues. Nice. Let that foot go, and go ahead, stretch the towel out again. Other foot. Okay, and go ahead and start dragging the towel. Now, if this is a repeat class for you and you're ready to add a little intensity, you would do that by just placing a light weight on the towel. So I have a 2-pounder here, and that's going to make it just a little bit harder for Hannah to pull, but you can ramp this weight up all the way to 5, 10, 15, 20 or more pounds, depending on how much strength you need from the bottom of your feet.
A couple of books could work.
Yeah,
Gallon
that's
of
great.
water.
A very small cat or dog.
If they are patient
Yeah.
and willing.
If they're willing to get dragged across the floor. Okay, and let that one go. All right, so just another specific drill for the bottom of your foot. And now finally, our kind of highest intensity drill is gonna connect the ball of your foot, the joint right there at the big toe, as well as the ankle. So here you're going to bend the knee just a little bit, real active stance. You can see Hannah has a hand on the wall for stability, that's great. And then before you move, engage as much pressure into the floor with your toes and forefoot as you can. And then very slowly pushing the floor away, start to extend the ankle so the heel comes up and flex the big toe joint. Okay, so this is basically practicing our push off that we need when we walk. When you get to your end range, pause. Again, before you move, start thinking of engaging all of the tissue on the front side of the ankle. You can see Hannah has the hands wrapped around the thigh to help, and then that motion will be just undoing the movement we just did, but with active control on the front. Okay? So as you go back and forth here, you really want to be clear. The way up, you're trying to contract the back of the ankle and the bottom of the foot as much as you can, moving slowly against that resistance. And then as you come down, you're thinking of engaging all of the tissues on the top of the foot, front of the ankle, and front of the shin. Now, one or both of those might not be that obvious for you at first, and that's kind of the point of the drill. So no sweat about that. But you could help yourself by providing a little resistance. So Hannah, if you just place your right hand on your thigh, really push. So now as you start to lift your heel, you're not just creating that contraction, but you're actually fighting against your upper body. And getting a little bit more engagement maybe in the whole leg, and really giving your nervous system a chance to work on this push-off drill. And then you could switch, put that hand on the back of the thigh, one or both hands, and just give yourself a little more sense of that pulling sensation to drop your heel back down.
Woo.
Good. All right, and let's let that go on that side. Shake it out. Keep in mind, that is a full body drill once we start to really get into that active shape for the foot and leg. So take the break you need, and then let's set up on the other side. Find a little bit of a knee bend. Good. Feeling very stable. And engage that pressure through your toes and forefoot to begin lifting your heel. Pushing off. Good. Finding that end range, and then switching focus to the front of the lower leg and foot, using that hand to provide a little extra resistance if that helps you, or if you'd like to increase the intensity of the drill. Good. Very nice.
Man, this foot is just so much slower.
Huh.
It's like I feel like I'm sending the same signal, but it's just going through like a longer tunnel before I feel any tissue change.
Yeah. Yeah, so really work at the speed of your nervous system. If you're not getting this clearly, then try slowing it down. Try focusing just on the contraction and not actually lifting the heel up and down, but just thinking of lifting the heel or pulling the heel into the floor. There's lots of ways to vary this exercise to fit your nervous system needs and your tissue needs. Good. Very nice. All the way down for your final rep. Go ahead, finish that rep and relax.
Woo.
All right, and then let's finish up with our retest movement. Come back down to seated on the floor. Okay, bend those knees enough that you can get your feet flat. And then again, like we did at the beginning, lift your toes. Start lowering just the big toes down to the floor. Good, nice.
It's so much easier.
A bit more control here, especially in terms of the quality of the movement that I'm seeing. So Hannah's able to move it smoother. I could tell that if she had to stop on a dime, she could just stop it, and there's much less coupled motion with the little toes. So those are all indications of kind of progress or improvement.
Also, I sort of feel more crampiness from the big ball of the big toe up into the arch.
Yes.
Like there's tissue that's like, hey, I'm happening.
Yes. So now keep those big toes up and start lowering the little toes. One little note, especially if you're someone who struggles with bunions, that is a kind of a formation of bony tissue on the inside of the toe. That can sometimes be accompanied by a big toe that's sort of like angled in towards the other toes. Not a problem. It's a very functional way your body has figured out how to work, but it will. You'll want to feel that engagement that Hannah's talking about on the arch that pulls the toe actually kind of more in line with the foot and out of pointing towards the other toes. If that didn't make sense to you, don't even worry about it. But for people with bunions, you'll be like, oh yeah, I know what you're talking about. All right, and let that go. Very nice work. Let us know how it felt, and we'll see you soon.